this morning I'm going to be talking about a disease we see quite frequently from now on in springtime, and it's coccidiosis in both lambs and calves. Okay, particularly with calves that turn out and lambs that are out of pasture. We can see it in the sheds also. Now the thing about coccidiosis is a protozoan parasite. It's quite small, but there are a number of different species with lambs and calves. Some of them cause disease and some of them don't. The disease causing strains we call these pathogenic strains. So I suppose it's useful when we're thinking about coccidiosis, we're talking about diagnosis, is to make sure that that we're looking for the pathogenic strains, the ones that cause disease. So the symptoms, everyone's aware of the symptoms. Traditionally this black bloody scour, potentially straining, animals in quite a bit of pain, lambs and calves in pain. But it can also be, I suppose, more difficult to see. It can just be caused by ill thrift, weight loss, animals not survive, not putting on condition. But we would classically be expecting that blacky scour. We never make presumptions about any scour, and I will talk about that in diagnosis. So what is actually happening? This is a tiny little protozoan oocyst, and what happens is this is the lining of the intestine here. This is the gut where the food transfers. And what this does at a microscopic level is these parasites invade into the lining of the intestine. They grow inside there, and what they do is they burst or shed all these thousands of oocysts. So there's two things: invading the gut lining does damage, and especially when there's this explosion of these new oocysts. So that can do a lot of damage to the lining. But I suppose this is the early stages when you have low numbers. But an animal can ingest small numbers, but can shed thousands of these oocysts. So it's one of these diseases again that builds over time. The infection levels build from one animal to the other. So that's what it does. It damages the lining of the gut, and that's why we see that bloody black scour. The intestine is damaged. So where did the oocysts come from? I suppose originally the main source, the starting source can potentially be, say, the dams, the sheep, the ewes or cows are spreading small numbers in their dung. And like this process, the early lambs and calves are ingesting them, they're getting them in, and they're shedding much more numbers. So this builds over time. And if the conditions are right, you can have quite a quick build-up of oocysts in the environment. So this is the shedding of the oocysts. The other thing is that they survive year to year. These oocysts are incredibly resistant to disinfection, and they can overwinter in sheds and on pastures. You can have pastures with high levels of oocysts. So that's two of the things but obviously when the infection is occurring and you're seeing clinical symptoms, this is where they can originate from, be it the pasture or the dams. But when you're in the middle of an infection, it's usually the infected animals that are spreading thousands and thousands of these oocysts. So that's the main thing. Immune response, animals, the lucky thing for us is if we can minimize this infection, calves and lambs will develop an immunity quite quickly to it. So they'll actually be, if we can keep the levels low, you won't see any clinical symptoms, they'll develop an immunity. In lambs we tend to see it from 3 to 12 weeks, we can see it in calves up to about 6 months of age. So which animals are most at risk? I suppose the young animals that are born at the start, they are being exposed to lower levels, or should be, and it's older animals then, as they go into older animals, they're still shedding. It's it's the younger animals coming along, particularly if you're mixing young lambs out with older lambs at pasture, and likewise with calves. The thing I will say is that they are affected by other stressors. So you could have coccidia, but if there's some stressing like debudding or weather changes or dietary changes, and particularly with calves, this can predispose to a fairly rapid onset of clinical signs. It's important to try and get a diagnosis with coccidiosis because there is different species, and I suppose with lambs particularly, we're at a time where nematodirus, which is the gutworm parasite, that can cause similar clinical symptoms, or in some cases there can be both. So getting a diagnosis, what you do with a diagnosis group, you take some of the affected animals and obviously maybe some of the other groups and try and get as many samples as you can to get a representative and try and see what species of coccidia are there, and are they the pathogenic or the disease causing strains. That is useful. Treatments. Now, there's two options. Obviously, you talk to your own vet about individual treatments, and individual treatments involve rehydrating the calf, keeping them on milk, rehydrating the lambs. You use something like the taltruzerols or the diclazerol products. So treatments, that is individual treatments, something you talk to your vet about. What the real aim of when I talk about treatments, it's about preventing disease. So we call prophylactic use of these products, like diclazerol or toltruzerol. Now, I would say my own experience is that toltruzerol, because it's a longer persistency of activity, it's a much better product, certainly for calves, and in my experience with lambs as well, I get better results with it. But the key thing is to be using it before the risk period. What it'll do is these products will reduce the amount of shedding and will reduce this build-up of infection. So if they're given at the right time, for example with calves, sometimes we'll give it a week post turnout. So those calves that might be harbouring coccidia, we'll give them that dose and they will reduce the shedding and reduce the build-up in the environment. So look, that's one thing. There's decoxinates which you can put in feed, which I don't use personally, and they're another option. But really what I want to emphasise is the timing of the preventative dose is critical. So if you've had an issue last year with lambs or calves, thinking this year, when did I see it? When would be the best time for a dose now to reduce shedding? And also we have to think about the environment. We have to think that the environment is a source. We have to look at disinfection of the environment, because often these problems, we'll see it outdoors, but we'll actually, a lot of the problems will start, infection will build inside. So if you've seen coccidiosis in a problem with lambs or calves, you know, getting the shed clean year to year. Also, so chenococcus, the problem with it is very resistant to treatment. The chenococcus or the intercossac are licensed for treatment, so make sure you're using a product that will actually kill these oocysts in the environment. And I suppose finally, if we've at-risk pastures, because they can survive year to year, so if you're turning out calves or lambs in pasture and you're getting coccidiosis year after year, we must look at a couple of things. That's an at-risk pasture, but particularly there'll be a build-up of oocysts in wet conditions where calves and lambs are congregating. So for example here I've represented a group of calves or lambs. If they're congregating around a creep feeder, for example with lambs, or if there's a water trough that's leaking and there's a dirty area of the field and there's lambs and calves dunging in that area and they're congregating, that can be a heavy source of oocysts in the environment. The other thing I'd like to say is, just to go back to that point, you know, when the coccidia get in, they're just constantly, it's a build-up of shedding. So you can imagine just a couple going in more and more, and literally the shedding increases. So what we want to do with our dose, and this is back to the treatment, is we want to get in here at a time where we have low levels in here and you reduce this shedding down. Because if we don't, we're getting to a stage where there's just so many oocysts being shed that these animals down here, you know, are succumbing to infection, that they're overwhelmed by the levels. So the timing of the dose is critical. So that's kind of a brief rundown on coccidiosis. I probably missed bits of it. So I suppose the important things is, look, we know the symptoms. If you had a risk before, think about the timing of the dose, looking at pasture risk, managing areas of the field where they're wet and mucky or animals are congregating, even moving creep feeders from over time and not letting them, you know, become real areas of contamination. That can help. Getting a diagnosis, make sure that it is coccidiosis we're dealing with, it's not something else, whether it be nematodirus with lambs or whatsoever. But treatments as well, just that timing of that dose with your vet is very, very, very important. And just if you're using disinfection in houses, just think about it's a disinfectant that's licensed. So that's coccidiosis, a whirlwind tour of coccidiosis. Thanks very much for listening to this video blog.